All right, I am back. Sorry for the delay and just having some technical issues today, but I'm going to be talking about pain relief, how to get pain relief naturally, and relieve any spine or joint pain. And we're going to be talking about different ways that I assess the spine and the joints in the clinic, and then how I go about treating that, and some of the recommendations I make here to the patients at Tut Street Family Chiropractic. So my name is Dr. Cary Yurkiw. I've been a chiropractor for 30 years now, and I've seen many patients with neck pain, back pain, and joint pain. And the first thing is to properly assess the cause of the problem. So when people come into the clinic, we do a history. We want to find out more about the cause of the pain, how long it's been there, what the other factors are, what the general overall health is like. And then what we do is we do an examination, which includes posture, ranges of motion, and other types of physical assessments. And then we let the patient know exactly what we found out and how we're going to go about treating that condition. So I'm going to go into that a little bit here. Then I'll talk about treatment, and then I'll talk about things that people can do to help themselves. So what are some of the causes of spinal pain? One of the major reasons for spinal pain is injury. So if the person has been injured, let's say they're in a car accident or they had a work injury, then they can have damage to the joint or the tissues. Posture is another reason. So people that sit slouched, or they're looking down at their phone or their computer a lot, develop pain where the neck meets the shoulders. Scoliosis, or curvature of the spine, like this one, can cause pain because the muscles on one side of the spine have to contract, and on the other side they have to stretch to accommodate for the position of the vertebrae. Lifestyle, like poor nutrition, poor sleeping habits, not enough sleep, can contribute to back and spine pain as well. And then ergonomics, like your workstation, if you drive a lot, the way your car seat is set up, your steering wheel. So ergonomics is the positioning of your body when you're working. That can have an effect. And then your habits, of course. So any bad habits can contribute to spine and joint issues, and over time can lead to some breakdown or degeneration of these joints. Joint pain is similar. Let's say pain in the knees or the feet, the elbows, the wrists. And I saw quite a few of those today as far as wrist pain and elbow pain, tennis elbow, plantar fasciitis, which is pain on the bottom part of the foot, TMJ, jaw joint pain. So there's a number of different types of joint pain that we see in the clinic. And again, understanding the joint itself and the mechanism of the joint. For example, with the knee, this is a hinge joint. So for the hinge joint, it flexes and extends, and it can have a little bit of play side to side, but it's got the patella on top of it, the kneecap, and that's to protect the joint. And then there's the fibula, this long bone right here. So understanding the joint and how it works, and then the mechanisms of injury, like soccer being something that really affects the knees or the ankles, like tennis affecting the elbows and the shoulder. It's very important we understand what's causing the joint pain, and then how we're going to go about correcting it. Now, there's other types of joint issues like arthritis and rheumatoid arthritis that we see in the clinic. Osteoarthritis, which is one type of arthritis, and the most common condition we see in the clinic, is a breakdown of the joints and a wear and tear of the joints. But rheumatoid arthritis is a systemic inflammatory disease that we see in the clinic as well, where multiple joints are being affected. And posture and lifestyle can affect those joints as well. So can ergonomics and habits. If you're an athlete, the way you run or the way you do your physical activity. If you're, working and you're using a wrench, let's say, and you're using a wrench a certain way, or if you're a hairstylist and you use your scissors a certain way, then that can cause things like our carpal tunnel to develop in the wrist joint. So it's very important that, again, we understand the mechanism of injury, the mechanism of the pain and discomfort, and then we go about assessing that properly and treating that. And there's over 200 bones in the body, so understanding how the bones should be lined up and how the bones should be moving is very important for health and well-being as well. Now, what are some solutions to spine and joint pain? First, we do chiropractic care, and chiropractic is safe, effective. It's a natural solution for spine and joint pain. And some of the treatments we do are hands-on treatment, so kind of traditional types of chiropractic treatment, and that can involve adjusting the joints and the spine by hand, so manual adjustments. Other types of adjustments we do in the clinic are instrument type of adjustments using something like this called an activator to do adjustments. We have another instrument called an integrator that does adjustments as well. Different types of techniques, different purpose to these adjustments, but the goal is to realign the spine, the joints, increase the function and restore the body to the way it should be working. So that's the principle behind chiropractic and the instrument and hands-on adjustments. And chiropractors, I think the way we're different than other professions is that we have a belief that if the body is lined up properly and if it's working right, so if the joints are working right, the nervous system's functioning properly, it can keep the body strong and healthy. So it's kind of an inside-out approach versus an outside-in approach. And that's how chiropractic is different from other types of healthcare where there's a different focus. Now, the principles and benefits of chiropractic care can involve reducing inflammation, because when you have better alignment, better range of motion, inflammation is reduced, and that allows the joints to heal. So you're going to feel better with the proper alignment and mobility in those joints and the spine. And this enhances wellness and well-being. So, let's use this as an example. When the posture is poor and you're slouching, it's going to compress the rib cage, affect the amount of oxygen the body's going to be able to take in. It's going to cause stretching of the muscles on the front, on the back side, and contraction of the muscles on the front, and it's going to cause imbalances. So naturally, if we get the body lined up properly, good posture, good range of motion, it's going to be stronger, more energetic, better oxygen. So posture and alignment affects not just the one joint, but it can affect other areas as well. So we do the hands-on adjustments in the clinic, instrument adjustments. We have special tables to do adjustments, tables that'll pop up and push down to do adjustments. And then we use other instruments like the Y-strap. And this is a decompression tool that allows for the pressure to come off the joints, spacing the bones better, allowing less pain and discomfort. So I like to use the Y-strap or a spinal decompression tool after I do adjustments. So when I do, let's say, a neck adjustment, then doing the decompression just to stretch out the spine to help reinforce that it should be in a better place, the way we just adjusted the bones into that better place, and then doing that decompression for that area. Other methods to help with tissue healing are shockwave, and I have the shockwave unit right behind me right here, and laser. And so these machines that we have in the clinic provide different types of waves that go into the body. So one type of wave is acoustic waves or shock waves that go in the body to break down scar tissue, calcium deposits. and improve the blood flow. Laser is the light therapy. And so the laser light goes into the body, and actually this diagram is for laser, and it shows that a certain nanometer of light will penetrate into the tissue a certain depth. And with the laser we use from Theralaser, it has two different wavelengths, the 905 nanometer and the 660 nanometer. These penetrate into the body, promoting healing of the soft tissues, including the joints. Also, orthotics and orthopedic shoes. We do that in the clinic to help with arch support, to stabilize the foot, and especially for conditions like plantar fasciitis or heel spurs or bunions. So those types of things can cause pain and discomfort in the foot. And last, products. So we have products in the clinic, and so these products are like back supports, ice, heat, which can really help people to deal with the pain and the discomfort, the inflammation and the swelling that they have. So in conclusion, the main points and takeaway of this webinar are, number one, we want to properly diagnose the patient's condition to understand what the underlying cause is. We want to then treat it the right way. So we want to treat it using hands-on or instrument adjustments, shockwave or laser, to promote the healing of the tissues. And we want to give the patient the right type of advice in between appointments. So, whether they should use ice or heat for their condition, what kind of postural or back supports that they need, how they should sleep. All of those things are very important for the proper healing of the area. And we want to correct the underlying cause so it doesn't lead to long-term effects, so that their body doesn't break down or degenerate and get arthritic, so that we correct the problem so the pain doesn't come back again. So it's very important that we focus on correcting the cause and then preventing a reoccurrence of that condition. I want to thank you for joining me today. Thank you for being patient and sticking with me through these technical glitches today. If you're interested in coming to the clinic, we are accepting new patients, so you can go to our website and you can book an appointment here at tutstreetfamilychiropractic.com. You can always call or message this number as well at the clinic, because then we can book an appointment for you. Usually we can see people the same or the next day, and we are open 7 days a week. So there's some benefits to coming to the clinic, including direct billing to insurance and ICBC if you've been in a car accident, and you don't need to have a doctor referral to come and see us. And if you're interested in this topic, you would like to know more, on Thursday I'm going to do a masterclass on this topic, and you can join me by going to Eventbrite to get a ticket. So feel free to go to Eventbrite and our page and then sign up for a ticket. And we're going to talk a little bit more about specific recommendations for specific issues. So the people participating will be able to ask questions in the chat, and I'll be able to answer those. And we're going to encourage more participation in the masterclass. So if you want to join me Thursday night, I'm going to be doing another webinar like this, a masterclass, talking about spine and joint issues, what you can do to help yourself, some stretches and exercises that you can do. And I'm hoping you can join me then. Please follow me here on social media and on